We are here now to talk to you about Reye syndrome.
Reye syndrome is a rare condition that causes serious liver and brain damage. If it is not treated promptly, it may result in permanent brain injury or death. Most recorded cases of Reye syndrome happen in children, but adult cases have also occurred. The exact cause of Reye syndrome is unknown, but most experts agree that a previous viral infection, and the use of aspirin, are important factors. For example, Reye syndrome has occurred in children who have been treated with aspirin for a viral infection such as chickenpox, influenza, gastroenteritis. It is possible that genetics could play a role in Reye syndrome. For example, a child may be born with an as yet unknown genetic tendency that makes Reye syndrome more likely. If this child then has a viral infection and takes aspirin, or one of the active ingredients in aspirin, such as salicylate, this can trigger the condition. Reye syndrome is thought to damage part of a human cell known as the mitochondrion. Mitochondria provide human cells with energy. Mitochondria are particularly important for the healthy functioning of the liver. The liver depends on mitochondria to provide energy for many of its vital functions. Once the liver loses its energy supply, it begins to fail. This will result in a dangerous buildup of toxic chemicals in the blood, such as ammonia, which will damage the body. The loss of liver function can make you lose your energy, make you vomit, and feel tired. The rapid loss of liver function causes the brain to swell, leading to the changes in mental state associated with Reye syndrome, such as confusion and delirium. The symptoms of Reye syndrome usually begin a few days after the development of a viral infection. Initial symptoms of Reye syndrome include persistent, effortless vomiting, listlessness, and lack of interest or enthusiasm, loss of energy, drowsiness. As Reye syndrome progresses, the symptoms may become more severe and wide-ranging. They include extreme irritability, agitation, delirium, sometimes with hallucinations and anxiety, coma. Symptoms of Reye syndrome are the result of the loss of normal function of the body. Loss of liver function is what causes persistent vomiting, tiredness and loss of energy. The rapid loss of liver function causes the brain to swell, which leads to confusion, delirium, and other mental state changes associated with Reye syndrome. Brain damage is the main complication of Reye syndrome. However, spending several weeks in hospital may also affect your child both physically and psychologically. For example, after returning home, your child may have symptoms of depression or anxiety, be clingy or needy, have a fear of hospitals or healthcare professionals, wet the bed. Brain damage can range from mild to severe. The level of brain damage experienced usually depends on the amount of swelling in the brain. In general, brain damage is more likely if Reye syndrome were severe. Specific difficulties associated with brain damage that have occurred in children who have had Reye syndrome include poor attention span, poor memory, speech and language problems, problems with motor skills, some loss of vision, some loss of hearing, problems completing tasks, difficulty swallowing, difficulty using the toilet, difficulty dressing. Treatment for Reye syndrome will require immediate admission to an intensive care unit.
Thanks, Brian.